Okay, today is June 26, 2024. We're going to talk about Dr. Mcdougall's stroke because I think there's a lot of misunderstandings about his stroke. He had a stroke when he was 18 years old. A stroke at 18 years of age is different than a stroke in an elderly person. Some other points to make about his recent death. He just died several days ago on June 22nd, 2024. Here's a picture of him when he was young, probably about in 1970. He's with Mary. You know, they got married pretty young as well. He's a pretty vigorous looking guy, all right? He's not a spinal cord patient, all right? A stroke patient in, intensive high-level rehab. Here's a picture of him recently. It was on his YouTube channel about 10 days ago. And the point I want to make is, look at him. He's intelligent. He's super intelligent, vivid, vital, okay? Yes, he's very thin. He had some type of fall around the age of 70. He just was 77 when he died a couple days ago. And apparently he had some fracture. I don't know all the details, but he was quite debilitated at that. Someone mentioned that he wrote about that in his newsletter from 2015. But what I'm saying is he was at his baseline. He wasn't going on a rapid downhill slope like a typical elderly deteriorated patient I see every day. Fell, hit head on blood thinners, rule out bleed. You know, all this stuff. I see that all day long, every day. I see all these old patients, most of them after 60. They're quite cognitively slow. They're progressively deteriorating. There was no evidence of that. He was in a stable state after his fall, and he lost a lot of weight. He was eating a lot of nuts, and that can be atherogenic, occlude an artery, but it doesn't seem to be the main issue of what's going on here. Okay, another point I want to make is he was a vigorous young guy, okay? Here he is, let's just estimate about 45 years of age. He's on a TV show. Look at his left arm. When he had his original stroke, he had a left hemiplegia, meaning weakness in the left arm and the left leg. But he's pretty vigorous looking. He was a tall, good-looking guy, okay? And he goes water skiing, jet skiing, okay? You don't do that unless you're pretty physically fit. So here then is a picture of him giving a talk. And if anybody's seen his old talks, like if you go to VegSource, they got some of his old talks where he's walking around on stage giving a lecture. He's a very vigorous, he's a genius. He's an intelligent, impressive man. And I want you to notice he's using both of his arms, okay? So he had a near complete recovery from his hemiplegia. He had some residual weakness, but this is a vigorous, active guy. When he completed his residency, let's say he's probably in his late 20s at that time, he goes and moves to Hawaii to live with Mary out there, okay? And he's a surgical assistant. You don't assist in surgical procedures if you're hemiplegic, okay? So the point I'm trying to make is he had a relatively full recovery. But I need to also explain some things about his stroke because I'm going to go into that in a moment. I'll show you some slides about brain arterial anatomy, so it'll all make sense. But let's say he's about 60 years of age here, looking quite good and vigorous and super with it, intelligent, obviously. Okay, so here is a picture of him with Mary. I'm just going to estimate this was when he's about 70. Okay. I also just wanted to show you a page from his YouTube channel. I'm sorry, from his website. This is drmcdougall.com. And what I'm showing you here is that no one else in the world has this. Just, people think you go to the doctor to get well. No, you don't. You go to the doctor to get a pill. Internal medicine just, match the ill to the pill, send a bill. They never cure anybody. The patient takes those pills the rest of their life. The point I'm saying is, this is from Dr. Mcdougall's website. These are Star Mcdougalls. By the way, I was one of the Star Mcdougalls. He helped me to lose the weight when I was in my 30s. And I was having a hard time losing the weight. I got, most of it off myself, but the last, 25 pounds weren't coming too easily. Anyways, here's all these people, and many of them cured of life-threatening diseases. Coronary artery disease, diabetes, rheumatoid arthritis, other forms of autoimmune disease, intestinal problems, inflammatory bowel disease, ulcerative colitis, Crohn's disease, multiple sclerosis, all this stuff. So what I'm saying is he's got more than 20 pages. He's got so many testimonials and Star Mcdougallers, etc., that he stopped counting them. What I'm trying to tell you is no one else has that. This is what nutrition medicine can do. You never cure hypertension, diabetes, coronary artery disease, all this stuff, with pills, all right? Because they're diabetic, they're primarily dietary disease, also toxicology diseases, but you avoid a lot of the toxins when you switch to being all plant-based. But I just want you to know that there's a good reason why I say he's the best doctor in the world. I don't just say it for the heck of it. I don't just say it to be nice, okay? It's the truth, all right? All right, real quick, we're going to go through a little bit about stroke because I think there's a lot of misunderstandings. Lots of people have commented, oh, well, you know, he's been debilitated like he had a stroke. No, that's not the case. Okay, here's the ascending thoracic aorta. Comes off the heart right here. Brachiocephalic artery goes to the right side. The right carotid comes off there. Common carotid in the neck. Left common carotid right here. Okay, you can remember this by ABCs. Aorta, brachiocephalic, carotid, subclavian. All right. I made a previous lecture if anybody cares about, you know, how you can learn all this anatomy pretty quick if you want. All right, so here's the two main patterns of atherosclerosis. There's intracranial atherosclerosis, and that's also called Asian pattern of atherosclerosis, and especially referring to the Japanese in the 1960s when they're smoking tons of cigarettes and eating tons of salt, 12 grams or more a day. That causes hypertension, relatively isolated hypertension, and that's associated with intracranial atherosclerosis. For persons eating high-fat diets, they get a Western pattern of atherosclerosis, most typically in the coronary arteries, also in the Johnson, and in the internal carotid artery at its origin in the neck. Okay, that's classic Western atherosclerosis. I see that all day long, every day. All right, when a person has high blood pressure, the blood pressure comes up and hits the bifurcation. Here's the common carotid artery in the neck. External carotid artery goes to the face. I've shown you the thumb trick, you know. Basically, the way it works is your fingers are going to the face, external carotid artery branches. Your thumb is just going up deep into your brain. So this is the thumb, no branches. All right, well, anyways, when somebody's hypertensive, it hits against the median divider of soft tissue between the bifurcation of the arteries here. You get excessive turbulent flow, retrograde eddy currents, and that'll cause plaque formation, which is really a clot on this area in the internal carotid artery at its origin. The reason is excessive turbulent flow and retrograde eddy currents in excess are sensed by the arterial lining, the endothelium, as vascular injury. So they shed their antithrombotic glycocalyx and expose relatively thrombotic molecules, you know, things like VCAM, vascular cell adhesion molecule. Anyway, so here's the internal carotid artery. When you form clots up here, these will sometimes break off and cause strokes. Usually these are smaller strokes coming off the carotid, like little TIAs, transient ischemic attacks, but they can be bigger strokes. But anyways, I'm telling you, this is garden variety stroke in older people. I don't think that's what he had, okay? I think he had a dissection either of his carotid artery or his vertebral artery, because that's what strokes almost always are in young men of his age. Here's the anatomy of the brain. We're looking at the base of the brain, meaning the undersurface of the brain. These are the middle cerebral arteries, go out to the side. This is the anterior cerebral artery here. Goes down the middle like a mohawk, okay? Out to the side, it's kind of like male pattern baldness. Look at my head here, okay? Where my hair is, that's the middle cerebral artery blood supply. Where my bald is, that's the anterior cerebral artery. Actually, ACA is not quite this big. The MCA would come up a little higher, but you get the point. Okay, here's the basilar artery around the front of the brainstem, and then here's the posterior cerebral artery. So those are the three main arteries to the supratentorial brain, meaning the upper part of the brain, the cortex. ACA, mohawk haircut. MCA, like male pattern baldness or bozo circus hair. And then PCA is if you put your glasses on backwards in the back of your head. I'll show you a picture of that. It'll all make sense in a moment. Okay, here's a magnetic resonance arteriogram. We usually abbreviate these MRA. And again, it's kind of like a compressed axial submental vertex view, transverse view. And the bottom line is this. Going out to the side is the MCAs, middle cerebral arteries. Going right down the middle, that's the ACA, anterior cerebral artery. And then coming in the back here is the PCA. Okay, and that comes off the basilar. I'm just showing you this anatomy to make sense out of strokes. You don't need to know all this in detail. I just want you to have a general idea. It's all going to make sense in a moment. This is what I meant by the vascular territories. ACA is like a mohawk haircut, anterior cerebral artery. MCA is like male pattern baldness or bozo's hair. PCA, posterior cerebral artery, goes to the occipital lobes, visual cortex, and that's as if you had your glasses on backwards, which correlates with vision. Okay. This is just showing the brain. The cerebral convexities are convex on the outer surface. MCA goes to this area like we just said. ACA goes right down the middle, anterior cerebral artery like mohawk land. Okay. And one of the points I'm going to make is the blood supply to the brain is like a Goldilocks balance. You could also refer to this as being the Aristotle's golden mean, but the Goldilocks means you want your pressure high enough to get blood to the top of your brain, but not so high that it injures the artery and causes a stroke. Okay, so here's the usual anatomy that's important for strokes. And by the way, I've seen hundreds of thousands of strokes, okay? One of the things I do is I work as a neuroradiologist. I was an imaging-guided surgeon, and then I became a neuroradiologist. That's my conventional medical background. Okay, I've been a doctor over 30 years. I've seen so many strokes you can't even count them. All right, so anyways, here is the internal carotid artery going up to the brain. The anterior cerebral artery would be here in the midline, but I didn't draw it on here because the picture would be too complicated. And when people think of stroke, what they most often think of is an MCA stroke, middle cerebral artery stroke. You can get hypertension-related lacunar infarctions. Usually they injure these arteries right here called the lenticulostriae. It's going into the basal ganglia region. That's a super common type of stroke. See them every single day. Okay, this right here is along the cerebral convexities. And typically when you talk about a big stroke, there'll be like an embolism from the heart, and that will block this artery off, and you'll get a big stroke in the MCA territory. Little pieces of clot breaking off from the common carotid, the internal carotid artery origin, like I just showed you, those will cause tiny strokes, and typically in this territory here. What I meant by the Goldilocks balance was that if the pressure is too high, it causes injury to these arteries and causes atherosclerosis in these arteries, and you'll get these gradual, small, deep white matter strokes. If the pressure is too low, you can get the same type of thing. And by the way, these are all old people strokes. I don't think Mcdougall had this type of stroke. I think he had a dissection, which I'll explain in just a moment. But I just want you to see it. Here's a normal looking brain. This is a tight brain. We say tight meaning that the brain's up tight against the inner part of the skull. It's not atrophied. It is not a shrunken brain. You can barely see the cell side, just tiny amounts of cerebral spinal fluid in there. This is a sequence called a flare sequence, and it's really, just know that it's a flare sequence. It's like a T2 sequence. And you see how the cerebral spinal fluid is also dark. So here's the cerebral spinal fluid along the convexities. We usually call it CSF. All right, well, anyways, these are normal-sized ventricles. This is a normal-looking young brain. Here is a very typical-looking brain, let's say, of an 85-year-old. There's a whole bunch of abnormal, all this bright stuff, white stuff, are small strokes. This is the deep white matter, meaning it's the myelinated fibers. The cerebral cortex is like a ribbon. It traces the outer convexities of the skull. It's called the gray matter ribbon. Okay, and the deep white matter, this is where I showed that skull and crossbones on that last picture. This is the most common spot to get strokes, and they're usually real small strokes. Sometimes they're asymptomatic, and you can get a whole bunch of them. They can start to fuse together, merge, become coalescent. Okay, and this is a typical old person who's getting mentally slower and slower, physically and mentally slower and slower. Okay, these are the typical fell, hit head, rule out, bleed. They just start falling more and more often, then they die. That's a typical thing. When a patient starts falling like this, they're usually dead in a couple of years. Okay, this was the whole Jack Delatorre theory of vascular cause of dementia. You tie off the artery in the carotid, tie off the carotid artery in the neck of a mouse, and 2 months later, middle-aged and older mice were demented. But again, this is a gradual process. The reason I'm showing you this is to tell you Mcdougall looked great just a couple weeks ago. He was not a chronic debilitated guy. He doesn't fit any of this typical garden variety stroke stuff. None of it. Here's a typical severe hypertension strokes. When the pressure's too high, you injure those little lenticulostriae arteries I showed going up into the basal ganglia. And these are little cerebral microbleeds. When they're in the periphery, they'll sometimes associate those with so-called Alzheimer's disease. And this is a variant called cerebral amyloid angiopathy. It's often just called amyloid angiopathy. And me personally, after studying it quite a bit, I think it is strongly associated with hypertension. All right, here's a big intraparenchymal bleed from hypertension. These are rare. I hardly ever see these. I'll see thousands of these for every time I see one of these. Thousands of these old cerebral microbleeds compared to seeing, a frank intraparenchymal large macroscopic hemorrhage. Okay, these are rare. These little white spots here in the globus pallidi, the central part of the basal ganglia, those are just incidental calcifications. Okay, I don't think they're a good thing, but I'm telling you, you see those all day long every day. I even see them in patients in their 30s. Okay, so now what I wanted to get at was there's another type of stroke which we haven't really talked about yet. We'll talk about it now. It's a dissection. Oh, by the way, this skull and crossbones meant that if you overtreat hypertension, you don't get enough blood to this area because there's very poor collateral flow to the deep white matter. At the level of the ventricles, it's called corona radiata. Above the ventricles, it's called centrum semiovale. And this is the most common spot. This is where all those white spots were in that theoretical 85-year-old brain I just showed you a moment ago. And so I think you got to be careful. You need a Goldilocks balance. That's why you want to optimize your diet so your blood pressure is managed by your own body rather than by a pill. If the pressure's too high, you injure these arteries, you get those little hemorrhagic lacunar infarctions in here in what is called the basal ganglia, these deep nuclei, the cell bodies centrally. Cell bodies make the brain tissue on gross inspection gray, as in gray matter, because you got about 4 times more blood flow than you do to the white matter. So this gray matter ribbon is traced around. Cortex means bark, like the bark of a tree. So if you saw a tree stump cut, you see the darker bark around the periphery. That's what the brain looks like at gross anatomy. Gray matter ribbon, relatively dense tissue, and the deep gray matter nuclei, perhaps the equivalent of a cerebral cortex in primitive animals, in the basal ganglia deep here. Okay. So anyways, pressure too high, you injure the arteries, cause atherosclerosis, like we showed you for Japanese, Asian atherosclerosis. Pressure too low because you overtreat your hypertension, you stroke out this area. You also stroke it out eventually from just chronic atherosclerosis from hypertension or diabetes. Here's a classic stroke. Like when people talk about a stroke, they're often referring to a dramatic event. Could Dr. Mcdougall have this? Yes, maybe, but I strongly doubt it. The reason is, usually a person with atrial fibrillation have chronic atherosclerosis, okay? And they'll form a clot in the atrial appendage of the left atrium, and then they'll toss the clot up to the brain. It'll occlude the middle cerebral artery. Here's a CT angiogram of an acute stroke, and you can see there's a focal occlusion in the right middle cerebral artery. And so this area is all going to be hypoperfused. The normal middle cerebral artery, this is the first part of it, so it's called the M1 MCA, is intact here, and it continues in the M2, M3, M4 MCAs, and you got nice perfusion here. This brain is in trouble over here because you've occluded this artery, and so now you're not going to perfuse these areas so well. Okay, I'll show you the next picture. It'll make more sense. But this is a typical acute massive stroke. So here's an acute massive stroke where an embolus was tossed from the left atrium, left atrial appendage with AFib. It's occluded the right M1 MCA, and you can see there's a total absence of vessels over here. This is an acute emergency. These patients typically are hemiplegic on the other side of the body, so on the left side of the body. Okay, the catheter, interventional radiologist, really an endovascular surgeon, got a guide wire across it, used this catheter thrombectomy catheter to pull the clot out. These are clot specimens shown on the procedure table, and they were able to restore flow into the middle cerebral artery, M1 MCA, M2 MCA, M3 MCA, M4 MCA. So they've totally restored blood flow that previously was absent. So if you can do that in time before the patient's had an irreversible injury, you can prevent the symptoms of stroke. You can 100% cure them. Difficult to do though, difficult because the brain dies in 4 minutes if it has no blood flow. And by the time you get a patient to the hospital on the catheter table and get this clot out, that usually takes a couple of hours. So you would have had to have good intact collateral flow to preserve their neurologic function completely. So anyways, what I'm saying is you can form a dissection in the neck. You can get it from a massage. You know, I wouldn't let anybody ever massage my neck. I wouldn't let a chiropractor do manipulation of the neck. You know, they might be fine for lower back and stuff, but I wouldn't touch my neck. I worked at a stroke center for a while, and we'd get referrals of patients, young people, for strokes, and most commonly in a young person, the stroke was a dissection of the carotid artery or the vertebral artery. So this will be sort of a classic large stroke. I don't think he had a big, large stroke, because if he did, he'd be more debilitated. You know, he'd be, plegic the rest of his life. He wouldn't have he'd be unlikely to have such a fantastic recovery. All right, and I just want to show you too another pattern of stroke here. I'm going to show you common patterns of stroke. Like, where do people get dissections? People often get dissections at the skull base in the carotid artery. So like right about here, where the internal carotid artery enters the brain, they'll get a dissection. They'll get them right at the origin as well, the internal carotid artery. They can get dissections of the vertebral artery, often near the skull here. I'll see them. And then this can lead to formation of a small clot. The clot can then embolize distally. That means move distally into the brain and occlude an artery in the brain and have a stroke. So the point I'm saying is dissections are sometimes spontaneous. Most often they're post-traumatic in some way, and they heal usually completely, and they're not an ongoing atherosclerosis. They're not like accumulation of atherosclerosis. They're a one-time event. So I think that's what Mcdougall by far most likely had when he was 18 years old. So he was not chronically debilitated. I want to make that point. It looks to me like he died suddenly. I don't have all the information yet, and the family has declined an autopsy, but what I'm saying is it looks like he died from a sudden event, okay, as far as I know at this time. And the reason for this talk was just to make it clear. He did not have what looked like a dissection of the basovertebral system. He did not have what seems, to be a large MCA stroke. Most common big stroke is in the MCA. Okay, I just want to real quick give you another thing that'll stroke out the posterior circulation. Normally people have a relatively robust basilar artery, which then is the main blood supply to the posterior cerebral artery, the PCA. And you'll have small, sometimes not even visible, posterior communicating arteries that connect the anterior circulation, meaning from the carotid, with the posterior circulation, meaning from the vertebral arteries and the basilar artery. Some people get a normal variant whereby they've got a small basilar artery because this fetal embryology anatomy of having big posterior communicators connecting the anterior to the posterior circulation leads to the PCOM supplying the occipital lobe, and thus you don't need to develop a basilar, so they get a really small hypoplastic basilar. So this is congenital persistent fetal type PCOM PCAs, big anterior circulation supply of the occipital lobe such that there's no reason to develop a fully developed basilar. And so because it's small, congenitally small, hypoplastic, you'll sometimes stroke this area. But again, there's no reason to think he had that. I'm just explaining the type of strokes. You could also get strokes from hyperthrombotic conditions. Hyperthrombotic conditions would be something like sickle cell anemia. That person can have a stroke as a teenager, but it's not from high fat accumulation of atherosclerosis, because it had also been brought up maybe he stroked because he was, after he'd had his fall around 70 years of age, he lost so much weight and he was debilitated, a little bit debilitated. He tried to gain weight by eating nuts, which to me sounded a little bit strange, but maybe that had something to do with it. But I doubt it. He's a little too vigorous and he's too smart. He knows a lot about atherosclerosis, does not push his luck with that, I would expect. Okay, so anyways, what I'm saying is if you have a hypoplastic, congenitally hypoplastic basilar, you'll sometimes stroke the basilar because even a tiny amount of mural atherosclerosis along the wall can occlude the pontine perforators, okay? So here's a paper just talking about the increased risk of brainstem and cerebellum stroke in people with congenitally hypoplastic vertebrobasilar systems due to persistent fetal PCOMs that are quite large. And so with this real tiny, almost diminutive, you can't even see it on this patient, basilar artery, they'll get all these brainstem strokes. So here's a stroke in the pons of the brainstem, sort of in the middle cerebellar peduncle, a bunch of cerebellar strokes, pop, 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 pop. Okay, so anyways, here's the absent basilar here, big honking PCOMs. So what I'm trying to say is all of these patterns of old person stroke, Mcdougall does not fit this picture. They're chronic, progressive, debilitating things. And a lot of these other diseases where a person chronically just goes down the tubes and wears out. There's no evidence Mcdougall had that. Mcdougall looked great just a couple weeks ago. When I say great, I mean he looked at his baseline as he had since he was about 70 after his fall. Okay, so there was nothing that we're aware of at this time to suggest a chronic deterioration. It seems more like he had a sudden death, and we don't know why at this point. So anyways, I hope that was helpful.